This is the Health and Environment Adaptive Response Task Force's first video on planetary health. We are a group of Canadian medical students who advocate and educate on the impacts of climate change on health. Today's topic is Displacement and Susceptible Populations, one of our 10 educational competencies. Our planet is changing, posing risks to many populations and species. Sudden and gradual changes in environmental conditions, such as land loss due to extreme events, most impacts minority populations, causing displacement. By 2050, anywhere between 50 and 200 million people are predicted to move either permanently or temporarily within or outside of their countries. It is important to recognize and manage health risks for displaced populations, including infectious diseases such as malaria, malnutrition, sexually transmitted infections, and mental health issues such as post-traumatic stress disorder. In developed countries such as Canada, individuals who are homeless or precariously housed will be some of the first to experience the effects of climate change. Increased air pollution, severity of floods and storms, frequency of heat waves, and changes in the distribution of infectious diseases will impact the entire population, with the homeless first. With air pollution mortality predicted to have an increase of 20 to 30% by the year 2050, we need to identify strategies that could protect those who are precariously housed from environmental changes, such as improved public policy, better urban planning, and clinical funding for these patients. Children and elderly populations in Canada are also at an increased risk of climate-related illness and injury. Risks to children include more severe forms of infectious diseases or malnutrition due to food insecurity. Meanwhile, the elderly are at risk from extreme events, as they are more often isolated, less mobile, and less able to respond to stressors. Finally, other populations such as the Indigenous people of Canada and individuals of low socioeconomic status are equally at risk due to poor baseline health status and reduced access to preventative and adaptive resources. For all of the populations previously discussed, it's important to understand that poverty mediates the health risks of environmental change. Poorer countries are more vulnerable to climate change, but wealthy countries like Canada are not immune. If you're a Canadian medical student, physician, organization looking to get more involved, or have any questions, please feel free to email us at heart.cfms@gmail.com. Thank you.